A recent study by the National Institutes of Health finds people of color are 3 times more likely to die during pregnancy than white people. It's this alarming statistic that led VCU health officials to hold an event today where they educated attendees on why there's such a gap. Joel Vasquez explains.
Health disparities between people of color and their white counterparts is nothing new. In fact, officials with VCU's Office of Health Equity tell me the reason behind this gap goes back to systematic racism and the lack of resources for those communities. However, by educating people on this topic, they're hoping to close that divide. 150 people packed this room in the Library of Virginia, listening to speakers talk about a topic that tends to get swept under the rug: Black maternal health.
They can also be involved. Participants have a role to play as long as they have an understanding.
This 2023 study by the National Institutes of Health found that Black women are 3 times more likely to die during pregnancy than white women. OBGYN Tashima Lambert-Giles says that's an alarming statistic. However, it's even more alarming when it holds true, if not more, right here in the Commonwealth.
In certain counties, you can actually see numbers that are higher than that, and we attribute that to having disparate care, not being able to have access to hospitals that have maternity care.
Creating what's called a maternity desert and are most common in Virginia's rural communities.
Those patients sometimes have to travel long distances. That's really inhibited by their ability to do so, by time to get off of work, by access to transportation.
Executive Director of VCU's Office of Health Equity, Cheryl Garland, says while that disparity gap has become smaller over the years, it's still extremely prevalent. One of the reasons is because of decades worth of systemic racism.
There's still concerns about whether or not medical racism still exists, whether or not Black women are being heard as they're interfacing and interacting with their providers, whether or not there's some bias that still exists within our healthcare system.
But that's why they hosted this event. By giving people the chance to listen to experts and patients talk about Black maternal health, they hope this can be the first step to end injustice.
The education is critical, because if we are not aware, then we will continue with the same practices, utilizing the same systems, and implementing the same policies.
In Richmond, Joel Vasquez, 12 on your side.
A San Diego doctor